If your interest is in developing relationships with people and the challenge of making a difference to people who really suffer, I think in a way that it's very difficult for any of us to help or to get through to them, then if you like a challenge, if you want to, the thing that gets me out of bed in the morning is the thought of that patient I'm going to reach who feels that that nobody can get through to them, that absolutely nobody can understand, and the moment when one finds a way of making contact with somebody like that, and that moment of engagement where you know that you've given somebody hope who has almost completely given up, that is just, there's nothing like it. And almost invariably I find it is that relationship that one develops through the business of engaging and making contact with somebody and developing that sense that there is hope of a different sort of relationship and a different sort of future arising out of that relationship, that prevents people from killing themselves. It's a life-saving thing.
I think there is something about really needing to have a curiosity about people.
Mm-hmm.
Some of that might be a curiosity about yourself and how you got there and what all of that means, but really being interested in how people work and what goes wrong and how does one understand that. And I think, if as a starting point, that's an absolute essential.
Because as a doctor, I felt I learned all these tools with which to treat patients, things I could do like prescribing a medication or referring for surgery or some such. But as a psychotherapist, I feel like I almost get to be the therapeutic tool.
I remember getting extremely frustrated at medical school and being a junior doctor with the amount of, biological reductionism and also reductionism at work, in that you go and speak to a patient, you gather all this information, and actually you only wanted to know two things to make this diagnosis of, a heart attack or something, and everything else that the patient brought to you was pointless and useless, in order to make that diagnosis. Yet it sort of, to me, was like very meaningful, and I sort of wanted to do something with all that information, and the information they gave me was sort of much more interesting and fascinating than this sort of diagnosis of a heart attack, which obviously is important. If someone's got a heart attack, they need to be treated and someone needs to do that, but I guess it didn't really interest me. What interested me was what they were experiencing, and I think
the person in front of you.
the whole person,
Yeah.
not putting them into this box or label or seeing them as an organ. That to me isn't interesting.
I think you're describing a very strong emotional reaction to a patient in distress, and I think psychotherapy is the area that allows you to kind of use that as your primary tool to work. Yes, the patient will need oxygen and an ECG for all but if you want to make that your own emotional responses and what the patient triggers in you as your primary tool to work, I think psychotherapy and medical psychotherapy can be a really good opportunity for that.
I think I always wanted to be a psychotherapist, actually, and not a doctor. I really wanted to just sit in a room with somebody and explore their lives and what was going on for them. And I thought that's what doctors did. And then I went to medical school and discovered that there's a lot of other things that doctors do besides that. But then I also did enjoy that. I enjoyed medical school and becoming a doctor, and I learned all these amazing things and developed all these skills that I don't want to let go of now. So for me, medical psychotherapy is a way to do both.
Because I did an arts degree first, a sort of social science degree, so sort of came to it from doing psychology and social science, and I did quite a lot of theatre and things, and so came to it from that side. But when I got to the end of that degree, I really felt that I wanted to understand the medical side of it as well, that carrying on along the psychology path without having the medical things underpinning it didn't feel quite right to me. So seemed to spend a very long amount of time getting in that extra bit, and then feel that it's only really since getting onto medical psychotherapy training that now I feel like the two are coming together, and the arts and the science come together, and the medicine and the psychology comes together, and it feels like Yeah, now it's making some sense. Now there is some meaning about the mind and the body all together.
Yes.
Yeah.
It's a privileged field to integrate all these different ways of thinking, really. And it's, so I imagine that, you feel comfortable as a medical psychotherapist when you're comfortable in that kind of transitional zone between, objective scientific knowledge, but also enriching that experience with the subjective experience of finding a patient in the room and trying to make sense of that encounter and use that emotional experience to kind of enrich the way you think as a psychiatrist, perhaps. So it's always keeping a dialogue, like an internal dialogue between very different paradigms of the mind.
I'm a trainee, just come to my end of the training, and you have to fully immerse yourself in it because it tackles every part of your personality, every part of your sense of self, and it has to be investigated. You have to be in that place to be able to do that so that you fully can engage with with patients and people. So that's medical, that's the psychotherapy aspect. And so as a practitioner, that's kind of the training that you get. And then hopefully that will correlate with working with people of all ranges and being able to engage with them and being hopefully of some use. As a medical psychotherapist, it's all about teaching and supervision, which is amazing. And hopefully everything that you learn to pass on, because fundamentally it's about making a change in people's lives. And I think a lot of the people I speak to in medical psychotherapy, they're so creative and they're so committed and they're so wanting to make a change in people's lives, but in a really personal, emotional way, that then to pass that on to people who are not in the field, it's a really interesting dilemma, because how do you help somebody to feel and feel what their patients are feeling without getting completely overwhelmed by it? And I guess that is our training. We have to learn how to feel what our patients feel and then still keep our minds to be able to work it through, and then hopefully pass that on to our patients and the people we meet, that they start to be able to think through their emotional problems. It's the doctor in the hospitals who really wants to sit with patients, really wants to get to know them. They're just really interested in life, in the society. They watch movies and read books and they're really interested, and I guess they're always a bit interested in ethics and philosophy, a little creative, but
very special type of curiosity, perhaps, about the patients and themselves as well.
So if you're interested in a challenge which uses every part of you and engages you in a very personal way with other people, in a way that you feel you're really doing something that probably very few people around you are qualified to do, then this is your job.